Welcome to Scientifically Speaking. I'm Joel Cohen, and today we're going to be discussing the skincare marketplace and the cosmeceutical industry. And with us today are Dr. Arisa Ortiz from the University of California, San Diego, Dr. Deirdre Hooper, who's in private practice near New Orleans, and Tatiana Kononov, who's the Chief Scientific Officer from Revision Skincare. So Deirdre, let's have you start. So you're wearing a hat this morning. Tell us a little bit about yourself and your hat.
Thank you so much for having me, Joel. I'm excited about this conversation. I'm Deirdre Hooper. I'm in private practice in New Orleans, and I work with the residents at LSU and Tulane. And I had to think about what hat to choose because I do love my Saints and I love all my sports around here. But my daughter and I have really gotten into horseback riding. She's always been into it. And during the pandemic, I've gotten into horseback riding. So I'm wearing a hat from our most recent horse show, and we're heading back to another one this weekend. So I'm using this as good karma for us.
Excellent. Well, living in Denver myself, my youngest, my almost 8-year-old, is really into horses. So Dr. Ortiz, tell us a little bit about your practice, your background.
Thank you, Joel, and I'm so excited to be here as well. Thank you for inviting me. So I'm wearing my UCSD hat. I am the Director of Laser and Cosmetics at UCSD and Associate Professor of Dermatology, so I'm representing today.
Awesome. And then Tatiana Kononov from Revision, who's actually the Chief Scientific Officer. So Tatiana, thanks for joining us.
Yes, absolutely. Yeah, excited to be here and with an esteemed panel here. Yes, I've been with Revision. It's over 19 years now, so a long time with the brand. And my hat, Penn State University, just a shout out to my family, all my sisters, my brother, and all my nieces and nephews in Pennsylvania.
Excellent. So I live in Denver. I spend a lot of time in the mountains, and just a shout out to the many animals out there that have a role in terms of, this is the avalanche hat for avalanche assistance out there on the mountain. And I wore this because we actually have a dog named Hank, and Hank was very important to us during this whole stay at home and still is. He's 6, so everybody was fighting for Hank's attention. So the other day we got a new dog, we got a puppy, and I named him Sheldon from The Big Bang Theory. So I want to talk to everybody a little bit about ingredients. So, Dr. Ortiz, when you talk to a patient and you're trying to get them on board with a skincare regimen, it's hard enough for us to get our patients to wear sunscreen. So, many of us start with a retinoid, and then we go through the whole discussion of how it works and some of the things that people can expect. Can you tell us a little bit about your pathway in terms of discussions with patients?
Yeah, well, of course, first I want to address their main concerns. So is it wrinkles and texture, or are they trying to deal with something like melasma and hyperpigmentation? And so obviously I'm going to pick ingredients that are going to target their main complaint. Some products may address multiple issues, but for the most part, they're meant to address specific concerns. So when they want improvement in texture, then like you mentioned, I may consider like a retinol. And then if they have hyperpigmentation issues, then I may consider more bleaching agents like kojic acid or hydroquinone.
So Dr. Hooper, you're at sea level as well. And, this discussion about sort of where to start. Somebody comes in, they're in their 20s or 30s, and they're really not embracing any overall skincare regimen. How do you have this conversation with patients?
Well, I agree with Arisa that it's so important to listen to what is the patient's primary concern. And in New Orleans, in the South, a lot of my patients, their primary concern is pigment. But what I find to be the most important part of my initial conversation with the patient is establishing my expertise. And it's really about talking to my patient. I have them tell me what they're using and I listen. And then I talk to them about what I recommend. And I always say, I'm going to recommend things in order of importance. And what's important to me is that if your skin stays nice and healthy, everything I do to you for this long relationship that I hope we're starting is going to work better. And so a lot of people come in, they're not even talking about their skin. A lot of my patients come in to talk about a wrinkle or a fold, and I say, your neuromodulator and your filler and your laser outcome is going to be so much better if your skin quality is good. And I just think really establishing myself as the person that they should ask and not trivializing skincare. You know, people look at these big dollar items, but they don't talk to me about just what creams they should be using. So I think that's important.
Thank you. And Tatiana, so this cosmeceutical whole marketplace is vast. There's less data than we really see in terms of medicine when we talk about drugs or other types of things that may alter structure or function. But from somebody who really is formulating these products, you have a very challenging sort of job. So can you talk to us about the way that you sort of think of key ingredients and the way that people hopefully can tolerate these ingredients in different geographies?
Sure, absolutely, and I think your last part of the question there was very key, that there are different geographies and different climates, and formulating for a broad patient population is very important. With ingredients, one of my largest responsibilities in our team is to really understand what is legitimate, what is credible, what is valid, versus what is a fad. There's trends that are emerging science, and that science is sustainable, and it's something that is going to affect the marketplace. And then you have your trends and your fads, and that's something we shy away from, in that it's something that's you know, short-lived, and getting results, but with respect, as Dr. Hooper mentioned, with respect to healthy skin. When patients have healthy skin, everything's going to be better. So that's what we look at as too, that's very, very important, and then combining them into an aesthetically pleasing product that they'll like to use.
So, you know, many patients, they know about retinoids, and, you know, I think the next category that many people talk to us about are really antioxidants. And there is a whole spectrum of antioxidants in terms of vitamin C preparations, vitamin E preparations, and then even vitamin B3 and niacinamide really does function in that sort of antioxidant category. And these are all working in different areas of the cell. So, you know, Tatiana, can you talk to us a little bit about how you really select antioxidants and how you incorporate sort of key ingredients or the type of ingredient that's most active in these formulations?
Sure, absolutely. So with antioxidants, blends work best. Absolutely, by far, it's what's most effective and most healthy for the skin. When you look at, the skin has different types of free radicals, different types of reactive oxygen species, and even reactive nitrogen species and carbonyl species, and we need a blend of antioxidants to really affect and neutralize the different types of free radicals. So but vitamin C, of course, is a workhorse. My favorite, I believe, that the gold standard is the tetrahexadecyl ascorbate, the THD ascorbate. But combining this, having coenzyme Q10, we know that it works well with skin. A little bit of tocopherol, vitamin E. You have your green tea and you know, just a variety. There's some workhorses, and then there's some new and different ones. Bakuchiol is another. It's actually a broad spectrum antioxidant, neutralizes many types of free radicals, pairs very well with retinol as well. So yeah, really looking at that blend is what's important.
Arisa, from a perspective of vitamin C and sort of transitioning to what you mentioned before, pigment, you know, in San Diego, you see different types of skin types. You know, Latino skin is something that you see very, very commonly. And I want to touch on, you know, sun exposure and pigmentation, and then the fact that many people come in and they're using something already, with hydroquinone probably being, you know, the most common one. So can you talk to us a little bit about sort of your discussion points and what you're looking for in terms of helping people out who seem to be prone to hyperpigmentation?
Well, the number one misconception with these patients is that they don't go outside or they stay away from the sun. And so sometimes they're not using sunscreen. So a very basic point is I make sure that they're using sunscreen every day, no matter what, even if they think they're like not going outside. So that's number one. And then, you know, to differentiate what type of hyperpigmentation, is it like truly melasma or just hyperpigmentation from previous trauma? So melasma obviously is the most difficult or stubborn condition to treat. So once we establish good sunscreen, then we talk about various bleaching agents. And so hydroquinone is kind of the gold standard. I actually like to compound a higher strength hydroquinone. So I commonly compound 12%, which I know is very high, but, and then I compound it with 6% kojic acid, but I compound in a versabase, which makes it really tolerable. And I like that a lot, but they need to understand that that is limited. You can't use that for years and years without taking a break, or obviously there's risk of ochronosis or permanent darkening. So then, you know, I want to alternate with another agent. And there are, you know, various products like topical tranexamic acid and, you know, other non-hydroquinone bleaching creams. But speaking of antioxidants, I actually really like Polypodium leucotomus, which is a fern extract, but it actually is also an antioxidant and kind of works as like an internal sunscreen, not to replace your SPF or your, you know, your topical, but in addition to, and that I find very helpful. And then of course there's, you know, peels and devices and things that we can do.
And then Deirdre, when people come in, you know, many people have their favorite products out there that they're using. So how do you sort of incorporate what you're recommending into their skincare regimen? Again, let's focus on pigment and sort of that category of antioxidants or vitamin C.
Well, I think it's important to be transparent, and I'll tell patients, listen, every company in the world knows what I'm about to tell you, that we're all going to say antioxidants and non-hydroquinone alternatives. Every company knows that, and they're going to produce a product. And this is what I know. If they show me a study, I can believe in the study. If they don't do a study, it doesn't mean it doesn't work. It just means I don't have the data. And so I tend to recommend products that have studies behind them. And I'm transparent with my patients because they do, you know, they're bombarded by Instagram and every spa and every friend they go to. What I try to do is start them on something that's going to address their, and I do agree, hydroquinone, and I compound it at higher strengths. Start that on day one. The patients that are bothered by pigment, they want that pigment gone. They understand that they sort of understand the long-term picture, but they want the pigment gone tomorrow. So I always start them on hydroquinone and a good sunblock. And I talk to them about mineral sunblocks. I think that's very important, and finding the perfect tint for their skin, which is hard to do in skin of color. There's some companies that make little skin drops so they can sort of titrate their sunscreen to be darker. Some companies make lots of different skin tones of sunscreen. So it's about finding a mineral sunscreen with tint, and starting hydroquinone is sort of my go-to with my pigment patients, even though I'm dying to really focus on my antioxidant and my retinoid. A lot of times with a new pigment patient, I'll get them to buy in with me on a good sunscreen. I'll start them on hydroquinone, and I'll bring them back relatively quickly. Then they have this trust established with me, and I say, okay, now we're going to add on the future, the long-term, the antioxidant, the retinoid.
So many of my patients come to me and they're already on hydroquinone and they've been using it for a very long period of time in many cases. And I don't think that people are as forthright right now about really discussing the limitations in what we know beyond 3 or 4 months. So I think, you know, Triluma was approved for use for melasma for 3 months, and there's very little data about the people who actually get exogenous ochronosis, but I've seen that. I've actually seen it recently in a patient with type 5 skin. So, you know, from a standpoint of what we can offer our patients when they've already tried hydroquinone, or they've already hit that few-month mark where you're actually concerned about them using it, especially high concentration. Tatiana, can you sort of take us through some of the ingredients that we're really looking at in terms of tyrosinase inhibition or to help in that overall pigment production pathway?
Yes, absolutely. I think from a core fundamental standard, vitamin C and a retinoid can be very effective. I know that we did a study on that, a 12-week study, really showing some help with overall evening of pigmentation, both the discrete and the global, and also obviously anti-aging effects as well. There's quite a few different non-hydroquinone alternatives. My perspective is there is not one molecule that works as well as hydroquinone. There's not. It's very effective. We all know that. There are some concerns. You know, you look at other areas of the globe Some allow it, some don't. The concentrations differ. But to Dr. Ortiz's point, shorter term, if you're staggering use and intermittent use, and definitely with a sunscreen, I think it's very helpful. I know the tranexamic acid, kojic acid, or butane, quite a few non-hydroquinone alternatives out there. If you combine them, you can, maybe especially along with a procedure, energy-based device or something, depending on the type of hyperpigmentation and the skin type. But it's a tough battle. I once heard a saying that you spend lots of appointments, resources, weeks treating hyperpigmentation. You go out into the sun for 10 minutes and it's all back.
So, when you're working with these different products and you're trying to integrate things into a combination, let's take, for example, tranexamic acid. Is that something that you can work with and you can combine it? Because we're starting to hear a lot more about topical tranexamic acid. We're also hearing a little bit about short contact therapy, like with cysteamine, which is the Cispra product marketed by Centec.
Yes, no, absolutely. And it's interesting. These products in different areas of the world have differing popularities. It's very, very interesting. So I do quite a bit of international travel to do this research. And there's different preferences, but the tranexamic acid, very popular in Asia. And, I think it's a very functional molecule, very functional compounds. I know there's even injections and oral use of that in different areas. The cysteamine, absolutely, there's solid data there. A little bit of an odor issue. There's sulfur group on that amino acid and different tolerability. Different patients have different tolerance for aesthetics. Yes.
So yeah, cysteamine can smell a little bit like an old-fashioned beauty salon. So Dr. Hooper, you do a lot of procedures in your practice. Chemical peels are important to your practice and Dr. Ortiz's practice and my practice. When we're using hydroxy acids in terms of skincare, there's a lot of sort of misperceptions that patients have in terms of, if something dries them out, then they say that they might not be able to use a retinoid. So really, how do you start to incorporate, beyond using a retinoid and beyond an antioxidant, some of the other things that we know that can help overall for skin health in terms of alpha hydroxy acids?
So I like alpha hydroxy acids, and I do like to add them into the regimen, but I say all the time that, and I think Tatiana made such a good point, like Americans in particular, when you look at international, Americans overdo and maximize everything. And so people love to just add 1,000 things and they're ready and they're so excited. And so what I like to do is start low and go slow. And I just keep going back to the long game. Like I think Arisa's point where people think they stay out of the sun, but I don't think they really do. They don't wear as much sunscreen as they should be using. People come to our offices and say, oh, I've been on hydroquinone forever, but really have they? Have they been using it BID consistently for 3 to 4 months? Because that's what they have to do to really see results. So what I do is I'll start my patient on whatever the basic regimen is. And if I'm gonna add an alpha hydroxy acid, I usually like it as, I like these little peel pads or what I like using. And I have the patient start 2 or 3 times a week and come back to see me. I sort of like to see my patients about 3 times a year. I think it keeps them honest and it keeps things under control. And if I'm adding alpha hydroxy acid and they can't be compliant with it at home, I'll have them do a series of peels. Those are sort of the 2 ways I do it, is either peel pads at home a few times a week. I like to separate that from the other products because sometimes, and Tatiana is more of the expert on this than I am, but I worry that the acidity will counteract another product. But I like to do either peel pads at home or a series of peels, sometimes both. But I like to go low and slow. I think that's important because the way a patient abandons you is you irritate their skin and they say, well, everything she gave me is just too strong. And I say all the over-the-counter things you're getting, their whole job is to not get returned to the drugstore or the Sephora. So it might be that I'm giving you a powerful ingredient. You just have to go low and slow.
That abandonment is such an important point because not only is it irritation, but it's significant bruising and swelling with fillers, or it's dropping a brow or something like that with neuromodulators. So on that theme of procedures, Dr. Ortiz, you do a lot of lasers and a lot of energy-based devices. And a lot of times our patients are asking us, what products are a complement to the procedures that they're doing and preparing for. And in my practice, I do a lot of resurfacing, and I believe that growth factors and that whole signaling pathway can actually help turn on some of the fibroblasts and sort of the collagen production in preparation and in recovery from laser resurfacing. So how do you approach sort of complementing products and procedures in your practice?
Yeah, so, I usually start with a conversation about protecting your investment. So you're spending all this money and you're investing in these procedures and you want to kind of prolong the results. So depending on what type of procedure they have, I'll choose a product for them that will help kind of protect their investment. So for example, like if they have rosacea, I may consider putting them on like a vitamin C serum or an antioxidant, because I feel like that can help decrease erythema or redness. Another conversation I have is decreasing downtime. So for patients who are doing like a really aggressive resurfacing, one thing I want to address is helping them decrease downtime. And there's various pre-procedure products that they can use. So one of the products uses tripeptides that they start a week or two in advance, and that can help speed up wound healing and also stimulate collagen production. The other issue is that, if they're going to do an aggressive procedure with me, I don't want them grabbing just random products from the drugstore that are going to give them an allergic reaction. So it's nice to have products that have been tested post-laser that I know are going to be safe. And so it's nice having like a kit that I can just have them grab from the office, and then I trust that they have an easy regimen to follow, and then they're not going to get in trouble in terms of like allergic contact dermatitis.
So, Tatiana, one of the things that I think we all three, Dr. Ortiz, Dr. Hooper, and I see, and everybody listening sees in our practice, is that many of our patients come in and they're focusing on keywords like, I want to use something natural, which the term natural when it comes to cosmeceuticals is not regulated at all. And then other people use the term, I'm looking for something organic, which actually is regulated by the US Department of Agriculture. So, a lot of times people don't realize that many of the products that we're talking about, for instance, a vitamin A derivative, or these other types of things, have a natural origin. So, from your standpoint as a representative of a company that's really the fastest or one of the fastest growing skincare companies out there, and really has a sense of sort of where people are with these things, can you talk to us specifically about the term natural or organic, or some of the things that people have misperceptions about specifically?
Sure. This is difficult. If we want to extend this to a day-long symposium here, that would be helpful. This is such a tough topic. It is such a tough topic. I understand that it is really very confusing for the consumer out there. It's confusing for us as a company. I mean, we really keep up on this, and it is bombardment with different types of information. But Dr. Cohen, to your point, there are certifying bodies for pure organic. The USDA, even there's the Oregon Tilth, Pennsylvania has one. That is the rarity. That's the absolute exception. That's something you're going to find in the health food store. It's very difficult to obtain, and you often sacrifice efficacy and aesthetics for that. There is natural, there's clean beauty, there's different definitions of what these terms mean. And from my formulation perspective, if you're formulating with respect to healthy skin and you're trying to get healthy skin, they call those two worlds kind of coincide. But it is, I equate it to cleaning products, really. Have you ever cleaned with all natural cleaning products? It's a different experience. It's it's a different experience, and not necessarily as effective and is a good user experience, but a tough topic. And yes, even sometimes natural. I've seen natural lines be higher in allergens. There's allergens out there in nature, and a lot of them. There's a reason why sometimes we we don't use all natural. But yes, tough topic, but something we absolutely have to stay close to.
So, one of the areas that I think we all see is that sort of transition point, which I always tell patients, in their 40s, especially, when we realize that 90% of our patients who really come in for cosmetic procedures and are really embracing the topical skincare that we recommend are women. There is that transition point where people start to realize what may actually boil down to estrogen changes and perimenopausal type changes. And there is data out there that within the first 5 years of menopause, that women lose about 30% of their collagen. So, when we specifically think about those changes that take place, so Deirdre, can you talk to us a little bit about, we do procedures, we do neuromodulators for hyperactive muscle, replace volume, and we're doing, chemical peels or other types of procedures, including lasers. But patients also want something that they can use every day that they feel is going to make a difference when they're specifically noticing the dryness or some of the laxity or some of the wrinkles that more acutely develop in really that late 40s age group. So, we, in our office, we did some of the studies on Emipel, which is a specific estrogen receptor activator, which is not a hormone, but it activates the skin estrogen receptor. So, from your perspective, how do you grapple with this particular problem in your practice?
Well, I think the most important conversation is just to make sure your patient is seeing her OBGYN and talking about whether hormone replacement is something for her, because that's an important conversation that we're not going to manage. I think two things to talk about. One is the exposome. There's so much you can manage. You can't control your own hormones. You can talk to your GYN, but you can manage all these other, they call it the exposome, with pollution and sleep and diet. So I talk to my patients about manage what you can manage and do everything you can to counteract aging that is not hormone related. The Emipel product I've used, and I like it. The vehicle is really nice. It feels really good. I've read their studies, and it's, I think, encouraging, and their safety data looks good. So I think that's something to talk about with your patients, and we need to watch and see. That's the only product right now we have that's specifically geared towards hormone-like effects without being a hormone. So I think that's a nice product to try, but I also think it's just doing everything else at the same time. Combination therapy, being sure you're repairing with your retinoid and your growth factors, and that you're preventing with your oral and topical antioxidants and your sunscreen, because you don't just give up. It's a long life ahead. And so we want to keep doing everything we can. And I think that's an important conversation to have with your patients.
So when it comes to specifically studying the interaction with the skin and some of the devices that we're using, a lot of people are looking for sort of that one topical product that they can incorporate. And, we call it kind of a hero ingredient where, something's going to have a role. And I think people are looking to bakuchiol. And Tatiana, I'm glad that you mentioned that, because that's something I wanted to talk about, because I do think that that's certainly trending right now. And I think there's perception issues where it's not a replacement for retinoids. It can be used in conjunction with retinoids. And I just want you to talk about that for a moment, because you formulated a product that actually has both in it. So, both are important, and talk to us about how they differ in terms of mechanisms and how they can be used together.
Yes, sure, absolutely. I'm a definite fan of bakuchiol. In fact, the scientist, the PhD scientist, originally from India, that brought this to light, the synergy with retinol and retinoids. I've worked very closely with him for many years, so caught on to this early, saw some of his studies, believed in it. We did our own studies and launched fairly quickly. But bakuchiol, it is not, it's not a new compound. It's actually from the seeds of the babchi plant. It's been fundamental to Ayurvedic medicine for many, many years. Has some great properties all by itself. The recent finding, though, why it's coming to light, is that it really has this great synergy with retinoids. Actually boosting all of its positive attributes and minimizing the side effects. That acclimation period that you go through for a few weeks helps patients through that. So what we did is we took our retinol products and added the bakuchiol and really showed better efficacy and tolerability, which is very, very helpful. There's some out in the marketplace, more masstige, touting it as a retinoid replacement. I'm, that I don't necessarily support, but the advantages of pairing it together are very beneficial and allow a broader patient population to tolerate retinoids.
So Arisa, post-procedure and the energy-based devices that we all use, I think that there is a lot of interest in sort of these kits, and you mentioned before, but many of these kits are something that it's a little bit more challenging to use, like after fractional ablative or fractional non-ablative lasers, because of really the columns that are poked really in terms of the holes in the skin. And we do see some patients that have a bit of an acne flare post-procedure. And I wanted you to talk about your post-procedure regimen and how it might differ for somebody who seems to be acne prone versus somebody who's not.
Sure. Well, with acne prone patients, it's well known that like non-ablative resurfacing, fractional resurfacing can trigger an acne flare. And oftentimes we're using these non-ablative devices to treat acne scars. So if I think that a patient is prone to an acne flare, I'll just prescribe an oral antibiotic that they take for prophylaxis to prevent the flare. And it may just be like for a week or two. So I would just address it in that way. But in terms of my post-procedure, it's usually fairly similar. So for non-ablative, I just want like a bland emollient, a gentle cleanser. I have them avoid anything irritating like glycolic acids or retinoids. I have them stop the use of those for like a week after, not necessarily before. I'm not so concerned about them using it before laser, but just after. Versus if I'm doing something more ablative, then I would want like an ointment, like a petrolatum base for a few days. So, I mean, in terms of like acne prone, it doesn't change too much. I just don't want them using like a petrolatum for too long because that can obviously increase the risk of breaking out. But usually I address that with oral antibiotics. Tatiana,
when you're having people sort of look at incorporating a skincare regimen into their practice, especially at times where, all of us healthcare workers are wearing masks most of the time anyway, when we see patients, and now during COVID, so many people are wearing masks. So I think, there can be certain products that are really designed to sort of help restore that barrier, especially in the areas where the COVID masks are causing irritation. So, if you can talk about some specific ingredients that are important in terms of barrier function and that we incorporate either as seasons change or we get more irritation from wearing things like COVID masks.
Sure. Yeah, absolutely. I find two things that, and they're really one and the same, but we look at them a little differently. Is you have a barrier function where when you look at your exfoliation and you look at the barrier with the ceramides, the cerebrosides, and all of the ingredients that help form that barrier. We also look at the microbiome. It's a very important part of what the barrier is. We even look at it as the sixth layer of the epidermis. It's so important. And naturally, when you have some type of covering, and especially in a humid environment, anytime you have an increase in temperature and humidity, you're affecting the skin, the pores, the microbiome. So absolutely throwing things off of balance. We weren't meant to be wearing these COVID masks, necessary now and understandably, but disrupting the skin for sure. So we treat that two different ways. Again, when you're taking care of skin health, you're naturally going to support that barrier. And we have different types of ingredients that actually help with some of these barrier compounds, even helping with stimulation of the skin's own production of more ceramides to really help with that. And then the microbiome, we even prebiotics. Really, we're going through and enhancing our line. Our new launches, you see prebiotic technology that really just allows the skin's own natural microbiome to thrive. That's really how we look at it. It's normally some type of oligosaccharide or polysaccharide, normally naturally based, and just really helping balance and diversity of the skin microbiome, which is key.
So during season changes, with the brick and the mortar and the corneocytes and really the areas in between, Deirdre, what are some of your favorite things to look for in terms of overall moisturizers for face versus hands, and Arisa, same type of thing?
I agree with Tatiana. There's some companies that are over the counter too that are doing prebiotic technology. Either they're using spring water to formulate their products, and that really resonates with patients. And I'm not in Denver, I'm in New Orleans, so it's still pretty warm and greasy down here. But as soon as the humidity drops, everybody starts getting a little dry. And I talk to my patients about, I say dry leads to chapped leads to rash or infection. So as soon as you get dry, you need to be intuitive and change your products. I like creamy, gentle cleansers for people that have dry skin. With the hand washing, we've talked about this all for months now. It's the 20 seconds. It's not the harshness of the cleanser. Creamy cleanser for your face. And I think what's important is to moisturize quickly with a moisturizer that feels good on your skin. And there's so many options out there, but I think it's that moisturizing within 30 seconds after you wash your face, within a couple of minutes, and your hands too, just to keep that barrier intact.
And then really last question for everybody, what do you think is really sort of the hot topic that's sort of coming up right now, where from industry's perspective, you're looking at in terms of the marketplace or product, and then from us as physicians, Arisa and Deirdre, what are patients asking for? What do you see in terms of the data and where some of the studies are going?
So, I think bakuchiol is definitely the one I've been hearing the most about. And that's interesting to hear what you mentioned, Tatiana, because I always thought of it as like a more gentle alternative to a retinol. But it's good to know that you prefer using them in conjunction. The other one is tranexamic acid, an alternative to hydroquinone. I actually prefer that in an oral formulation. I think it's much more effective orally than it is topically, but those are the two that I've been hearing a lot of buzz about.
Yeah, I agree. I think those two, and I think the other thing is the microbiome. I think it's just fascinating what's going on with microbiome research, and I think acne treatment, just in my opinion, is going to be revolutionized. I do the same as Arisa now. I give you an antibiotic if you're acne prone before your non-ablative resurfacing, but I think it's coming. And Tatiana, I hope all of you chemists are working madly, but I think that the microbiome is super cool and influences more than anything. And now people with the mask, it's one of those good silver linings of COVID is that people are like, oh, I get it. Like a different environment changes the skin. And so I think that's going to be another hot topic.
And Tatiana, from the cosmeceutical industry as a whole, it represents $14 billion in annual sales. So you probably have a lot of insight or market research in terms of where that's going.
Yes, absolutely. There's quite a few things that we're working on. I'm sitting here trying to decide what to key in on. There's so much exciting technology. But to Dr. Ortiz's and Dr. Hooper's point, definitely the microbiome. In fact, coming up next week, I'm attending a 2-day very intensive. It's an international microbiome conference, and specifically, we're looking at the skin with respect to anti-aging. Definitely with disease states, we know the microbiome is affected, and we're taking that a step further and really looking from an aging perspective. And it is just fascinating. It's really exciting and neat time to be part of skincare.
But it was fantastic to chat with all three of you, my friends, about skincare and cosmeceuticals and where things are going. And we really appreciate you all joining us for Scientifically Speaking.